Uh, can you also tell us more about tumor genotyping?
Yeah. So tumor genotyping is basically a facet of diagnostic test where a tumor sample that's acquired from the patient undergoes specialized processing. So genotyping is basically interrogation of the genes that are part of the tumor. So there are certain genes that are known as driver genes, which actually drive the cancer cells. There are certain genes known as, regulator genes. So the regulator genes actually modulate how, a cancer will behave. They control some of the other genes. So, as part of genotyping, what is done is, in a very simplified explanation, would be where a patient's tumor is sequenced. And based on the sequencing results, what we identify, whether there are good or bad genes, that report is shared with the patient's oncologist or provider. And then that provider will basically act on those if there are predictive markers like HER2, there is a targeted therapy for HER2. Similarly, for like in colon cancer, there's a gene called KRAS. If that's mutated, that's poor prognosis and patient cannot get targeted therapy. So in those cases, as a result of genotyping, we can give these specific answers to the oncologist and the patient's providers, so that the care team can then customize the patient's treatment.
Hmm. And in your opinion, what would you say would be like the most noted development in like gene therapy as of recent times?
As far as gene therapy is concerned, in cancer, it hasn't really impacted much. But in other conditions like Duchenne's muscular dystrophy, or in even with sickle cell, there has been progress with Duchenne's. You can have now the gene therapy is now FDA approved for treatment of this disorder. And even with sickle cell, you can have gene therapy where patients can be potentially completely cured.
Mm-hmm. Oh, that's amazing.